Now that you know what you can and cannot do as a rehabilitation promoter, we will expect you to work within your role or scope of practice. Listen to these key players from CBR explain why that is important.
Hi, I'm Dr. Lisa Dunham. I'm a family physician working in rural Guatemala. One of the things you're going to be discussing in your classes is working within the scope, your scope of practice. And what this means basically is knowing what you know and knowing what you don't know, and trying to practice within the limits of your knowledge and experience so that you do not have bad outcomes with your patients. This is not to say that you can't continue to learn more, but as you go along, you need to stay within those limits. Um, Someone might ask why is that so important? Well, for one thing, if you practice outside of your range of knowledge, you can easily injure your patient. You can delay their healing, and you can also have a very bad outcome, and you can be liable or be at blame for that outcome, and that puts not only you but also your supervising physical therapist and possibly the clinic at blame. So, like all licensed professionals and technicians and promoters, we want to be in about the work of helping patients to get better and not hindering their healing process. So we do whatever we can to help them and to limit the risks of bad outcomes.
My name is Emmanuel Perez, and I'm the director and president of CELSI Ministries in Chichicastenango, Guatemala. So, organizations like CELSI, they are ruled by the government, and we are established with under the rules that they have. So we have limits of what we can do. So when someone that, let's say a promoter, starts to do things out of the limits, that definitely can put in risk not only the promoter, but also the organization, because we can be fined, and even the government can close these organizations for putting people to do things that they are not capable to do, or they didn't have the education for. So that will be the main risk if someone starts to do things out of the limit. The family will be very affected, I think, first of all emotionally, because families put hope on the people that come. It's funny because sometimes, even to the promoters, people think that they are doctors, and they say, "Hey, doctor, how are you doing?" So, those kind of things is, I think there are high expectations from the family. So it's good that we are clear with them since the very beginning who we are, what the promoters can do, what they cannot do, so their expectations are low or realistic. What happens if they do something that maybe puts the patient in a worse condition? That is going to come back very badly to the promoter, because families get upset as well, and we do not want for something that was intended to bless to become a harm. And sometimes, especially in rural areas, when something bad happens, they do not investigate, they just act and react. So that can be dangerous for the promoter, it can be discouraging for the family, and it can kick back to the ministry or the institution or organization that are working with the promoters.
My name is Senor Rojas. I'm a physical and occupational therapist specializing in alternative and augmentative communication systems. I want to tell you a little about my experience working with CBR projects. I want to share with you that CBR is a program and has different levels and different parts. From my perspective as a professional working with rehabilitation promoters and working with rural communities, the work is extremely important, but also extremely delicate. Delicate because we have to take into account that although it seems that there is no law in our country for the work we do in CBR and the training we provide as professionals, The truth is that here in Guatemala, there is a law for people with disabilities. We have the Law 135/96 that is still enforced and is the law that frames the rights and obligations of people with disabilities. A person who works in rural communities has to know the laws and know how far their work reaches, what their training allows them to do, and how far to go as a person and professional to not disrupt the work of other professionals in the area. Law 135/96 provides a list of the rights that people with disabilities have, but also a list of obligations. It is important that we know them. For example, the Convention of the Rights of People with Disabilities is not only regulated in Guatemala, but worldwide. Guatemala has signed the agreement for the application of this convention, and we as professionals and those working in rural communities have to know what the agreement says. We have to be very clear about our role in CBR. We cannot do A, B, and C and try to tackle everything ourselves. We have to understand that our role is limited because we are only part of a whole, and that behind each one of us there is an institution, an association, or there is someone helping us and is acting as a column to support us to get the job done. We as professionals have a framework to follow. For example, as a physical therapist, we are part of the medical profession. A therapist will not be able to approach and reach the communities as a rehabilitation promoter does. But on the contrary, promoters cannot address the work of a physical therapist or a doctor because each person has their expertise and their limitations. For example, I want to share with you as a professional in rehabilitation, I specialize in working with children. I cannot work in other rehabilitation areas because I do not have the preparation, despite the years of study, nor do I have the necessary licenses to work with other areas of rehabilitation. You who are being trained as rehabilitation promoters have to know how far the guidelines of your work go and be very careful because there are laws that, although we do not know, but we should, are protecting people with disabilities or are protecting organizations with whom we work. We must know the laws of Guatemala. You've just heard from different key players explain why it is important that you work within your role or scope of practice as a rehabilitation promoter. I hope that you see that working within your role or scope of practice protects others, but it also protects you and the organization you're working with. Also, it builds relationships and it prevents you from breaking any laws where you live. As the director of TCI, it's really important that you work within your role or scope of practice for all these reasons, but also because it makes sure that we can continue training local people like yourselves in their communities. This video is not intended to be medical advice and should not be used as a substitute for professional diagnosis or treatment. The content is for informational and educational purposes only and is specifically presented for review by individuals already trained by Therapy Clinics International. Always consult with a qualified healthcare provider regarding any medical conditions or healthcare concerns.